Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about peripheral artery disease with board-certified cardiologist Dr. Elias Skaf. Okay, let's talk a little bit about signs and symptoms. And since this is a serious disease, it's important to know them.
Definitely. Let me start by saying that peripheral arterial disease, or PAD, Barb, could be completely without any symptom. The patient can have blockages in multiple arteries, and it could be severe or bad blockages, and the patient doesn't have to have any symptom. Now, the other common symptoms of peripheral arterial disease, or I would say other common symptoms of peripheral arterial disease, include cramping or pain in the legs. We call that, there is a specific terminology for that, we call that intermittent claudication, meaning that the patients will be able to walk for a certain distance, then at that certain distance they start having cramping in the legs. Once they stop walking, the pain will go away. That's the terminology for it. We call that intermittent claudication, quite common presentation of patients with peripheral arterial disease. Now, other symptoms include, beside of course the cramping, the patients could tell that my legs are getting tired and fatigued. So it doesn't have to be pain. It could be just a sort of fatigue and tiredness and low energy in the legs. That's what the patients describe it. Other signs of peripheral arterial disease could be of course, diminished pulse on physical examination. You can't feel good pulse in the feet or in the legs. Loss of hair because there is no blood flow down to the legs. Of course, other signs and symptoms include impotence is also a sign of also decreased blood flow. The temperature of the leg, even the patient will tell you, I feel my foot or I feel my leg is cooler than the other one. And on physical examination, you can feel that one side is really warmer than the other or cooler than the other. So this is pretty much the signs and symptoms of peripheral arterial disease. Now, advanced stages of PAD, once the disease left untreated for a long time, we start seeing what we call it tissue loss, where we start seeing the gangrene on the foot, we start seeing wound not healing well because there is no enough blood flow going down to the feet.
Now you're talking, even though peripheral artery disease is in all of these other places, most of the manifestations are in the legs?
Correct. Most of the manifestations are in the legs, more, or let me put it this way, more in the legs than the arms.
Okay. And the difference, because there's lots of things that cause pain in the legs.
Correct.
The difference is that it starts and stops with exercise?
Correct. So it's an exercise related, and one major difference that the patient will able to tell that I am able to walk at that certain distance. If I exceed that certain distance, the pain will start coming again. So the walking for a certain distance or the intermittent claudication is very specific symptom of PAD.
All right. How do you make the diagnosis then?
That's a good question, Barb. Actually, we make the diagnosis in what we call them invasive and non-invasive measurements. I'm going to go over that in details. The non-invasive measurements are, or tests, we do them in the office, and that include number one, what we call it Ankle-brachial index, or ABI. Basically what we do, we measure the blood pressure in the arm and measure the blood pressure in the leg, and we compare them. Normally, the pressure should be the same. If the pressure in the leg is lower than the arm, that is a sign of PAD and further investigation needed. Of course, we have other measurements or tests, and that include Doppler, ultrasound Doppler, and that's something simple, safe, harmless, can be done in the office, provide an excellent information about the location of the blockages and how bad the blockages is. Is it like 50%? Is it 70, 80, or 90? Now, other measurements, other tests we do in the hospital, we do what we call it peripheral angiogram or dye test, where we inject dye or contrast in the arteries and take a look on the blockages. Of course, we do have CT scan, and we do have an MRI as well. Wow. So we have invasive and non-invasive tests to check for PAD.
Well, before we get too far, I want to ask you, can you prevent PAD?
Definitely. So when I say prevent PAD, that means controlling the risk factors for PAD, and that include smoking cessation, controlling the diabetes, controlling the blood pressure, of course, watch the diet and try not to consume a lot of fatty diet and exercise. So basically, we're just managing or controlling the risk factors for peripheral arterial disease.
Well, anytime you say there may not be any symptoms, it's scary. So can you screen for peripheral artery disease?
Definitely. You can screen for a peripheral arterial disease, Barb, by doing the test we talked about it earlier, which is the Ankle-brachial index. Simple, straightforward test. We do it in the office, take literally 5 minutes. Tell right away if the patient has BAD or no BAD. And it's, as I mentioned, is outpatient. And we do it for patients complaining from pain in the legs to tell if this pain really BAD related or not BAD related, which could be arthritis, could be something else beside BAD.
And is PAD like any other disease you want to screen so you can catch it early?
Definitely, definitely. We like to catch it early because once we catch it, we need to treat the disease and prevent the progression of the disease to in the stages where the patients will end with gangrene, tissue loss, and all of that in the feet.
Okay, we're going to take a break and come back and talk some more.
All right.